Hi, I'm LJ.
And I'm Jennifer. We're of Three Moms Organics, and we're here talking today to Dr. Gerald Simons about tick awareness. And he's got a whole bunch of information and education for us all, and we're excited to listen.
Yeah.
Yep. Great, everybody. We're going to share some slides with you. So if you don't have a pen to take notes, this is your cue to get that pen and paper. Pause the video before you go on. So great. So I want to tell you a little bit about, what Lyme disease is, a little bit, the impact of climate change, some of the signs and symptoms, a little more about the bacteria. Those are those squiggly, like little corkscrew spirochete shapes you see on the slide. Some really like blow your mind treatment ideas. But really, if you follow Three Moms Organic on social media like I do, you know that prevention is the key. If you don't get the tick on you, then that's going to be like, the next big thing. So I've had Lyme myself. I've worked with the Stony Brook Southampton Hospital as a educator, helped establish their tick center. I'm an assistant professor at Stony Brook University, and I work private practice as well. If we kind of go through, some of the interesting data, just a disclaimer, this is my own ideas. It doesn't represent Three Moms or any of my different organizations. But if you've had any connection to the news, you know that Lyme disease has basically been all over the news, right? So we'll look at some of those examples here. First of all, when someone calls me up and they're like, Jerry, I had a tick bite, I like to think of getting a tick bite like stepping on like a dirty needle. Think about ticks. They live in the dirt. They live outside. They feed off of deer, raccoons, birds, reptiles, and you, right? So when someone gets a tick bite, it's like getting poked with a dirty needle. Now, there's a bunch of stuff from Three Moms about prevention, but I'm definitely into eliminating birds from your yard, right? Birds carry ticks. The bird bath and bird food attract rodents, which bring ticks to your yard. So I definitely encourage, in addition to the other Three Moms ideas, get rid of your bird bath, get rid of your bird feeder, because that brings a lot of ticks into your yard. But like I said, everybody is on their phone and keeping track of social media. And there's a couple of different debates about how we talk about Lyme disease. And also, there's been some famous names that have been talking about Lyme. So let's look at some of those pictures here as we go along. So if someone was to stop me on the street and say, hey, Jerry, how do you define Lyme disease? Believe it or not, a study from Stony Brook really has a very elegant definition of Lyme disease. Look at this. Lyme is a multi-system tick-borne infection caused by the slowly dividing spirochete Borrelia burgdorferi. So if someone comes to me in my office, they're like, Jerry, I have a crazy headache. It must be Lyme disease. I'm like, I don't think so. But if they're like, oh, my knees hurt and my head hurts, I'm like, multi-system. Okay, more than one system's involved. Now, the exception is if you get that red target-like rash, that's so well known. The other interesting thing about Lyme disease is it actually evades host immunity. And most of the blood work we look at looks for an immune reaction. So we've actively got a germ that is evading host immunity, which makes it even more difficult. This study also shows that the germ can reproduce, meaning that it can kind of like hide out and even become like reactivated. So that's like the classic Lyme disease definition. Another really interesting thing is there are many different types of germs that can cause Lyme disease. They're all Borrelia. Borrelia burgdorferi is the most famous ones, but there's also another famous Japanese one called Borrelia miyamotoi. And currently, if you go to the Mayo Clinic defines Lyme disease as an infection with Borrelia garnini, Abzelli, Mayoni, or Borrelia. Hey, people, I know we're getting deep in the microbiology here, but the point is Mayo Clinic looks at 4 different strains of Lyme disease, whereas the CDC still defines Lyme as being an infection with Borrelia burgdorferi. So that's really interesting. Just how do we define Lyme? Like, what germs are being affected? One of my favorite websites, besides spending a Saturday night with Three Moms Organics social media, I love the tickencounter.org website, where you can actually take pictures of ticks and identify different ticks. They have great trips on keeping ticks out of your yard. And they remind us that ticks are active all year round. Like even on Long Island in the Northeast, November, December, we're still finding ticks as long as it's not actively freezing. So you also want to write down that particular website as well. So prevention is key. We're still trying to figure out the definition. So let's look at some of these interesting like social media stories that we've been talking about. So one interesting story is as ticks are spreading north because of climate change, they are finding thousands, up to 40,000 ticks like on a baby moose. I don't know about you. When I was in college, it was all about save the whale, save the whale, save the whale. But now college kids are running around saying, save the moose, save the moose. Look at this quote from the Boston Globe. Moose are literally being drained of their blood. It's about as disgusting as it gets. This is how big the problem of ticks are moving into the Northeast and now even into Canada. With global warming, people have called Lyme disease like the first epidemic of climate change. And look at this data. They've documented that every year Lyme disease moves 4 kilometers north into Lyme each year. I'm getting calls from doctors in Canada that have never, ever seen Lyme disease. And as it's moving north, people are seeing Lyme in places they never thought that it could be.
Wow.
So people in Canada have to be very key on prevention. Right, Jen?
Yes. Yeah, it's very interesting. We have friends that live in Canada and they're saying the same thing. They're starting to see ticks there and, they're very worried, as they should be. But yeah.
Right. So all the preventative tips. Hey, you Canadians, all the Three Mom Organic and Tick and Counter prevention tips. Make sure you spend some time checking out all of those different types of things. So again, our key point is prevention is key. You don't have to worry about treating Lyme if you don't get exposure to all of those different types of ticks. Right, LJ? What do you think about that?
100%. We always say first line defense is putting permethrin on your shoes and then a natural repellent on your body and your clothes. You can also spray your gear. You can spray your camping stuff. You can, with Three Moms Organics or the repellent of your choice. We just want people to stay safe.
And still enjoy the outdoors. That's the thing. Right. Yeah, you could stay safe indoors. And I don't want people to be afraid of going outside. I have young kids and that's what made this come about, because I want them to be safe and climb trees and run and roll around the grass. And, I still check them after 100% all the time, but it's nice knowing, there are ways to do it safely.
Yeah.
Yeah.
And tick checks right after you come inside from outside.
Yeah,
absolutely. I always tell people put their clothes in the dryer because that heat kills the ticks. Don't wash them. And my weapon of choice is a lint roller.
Yeah.
Rolling a lint roller over your skin. If there's any like small ticks that haven't bitten you yet, they pick them right up, which is pretty incredible.
Sometimes you could step in a nest and get a lot of ticks on you, and they're like, pencil point.
Yeah. Pinpoint
size.
Yeah.
Yeah. Yep, that's that famous Labor Day weekend phenomena on Long Island where you step on like a nest of baby lone stars and they're so little tiny and microscopic. Next thing you know, you've got like 30, 40, 50 like little ticks on you.
That's exactly what happened to me, and alpha gal resulted from that. So that was 100% what happened.
Yeah, alpha gal, the meat allergy. We could do a whole nother talk on that. But I generally tell people if you get a Lone Star tick bite, that tick with the little white dot on it, avoiding meat for a few weeks may lessen the chance of you actually getting that alpha gal allergy.
Right.
Not scientific, just stuff that I've observed. So
Yeah.
I tell people all the time that you recommend doing that.
Yeah.
And I've done it with my family.
Yeah.
Yeah.
My mailman came over the other day and he had tick bites, and he came over and he said, "Oh, what should I do?" I said, "First of all, you should spray yourself every day." I'm like, "But second of all, avoid meat for 2 weeks." And what do you suggest if it's not just like a nest, but if someone actually finds a tick on them, what route do they go? I see it on all of the like mom groups that I'm on. People are always asking for advice of what they should do, and there's always a plethora of different ways that people can do it. Do you freak out right away? Do you send it out? Do you wait for symptoms? What do you recommend?
I mean, the key thing is to get that tick off of you very quickly with like a very fine, pointy little scissor, not using like any of I don't have as much luck with those tick spoons. I find a nice, pointy little scissor forceps is a great way to get that off. Check your body to make sure that you don't have any other ticks on you. And I've actually found good old-fashioned liquid iodine. Putting liquid iodine right over the tick bite reduces itch, kills germs at the site, helps to prevent any infection. And then that could be like a whole nother lecture, like who gets antibiotics and who doesn't.
Right.
But again, shocking but true. But I'm not a huge fan of sending ticks out to be tested. Because it's expensive. If you send every tick out, you might need a second mortgage because it can be very expensive.
Yeah.
And if the tick, listen to this, if the tick is engorged, right? Like the tick is obviously swollen, it's possible that their germs might have gone into you, the victim, and then the tick is falsely negative. So patients have called, they're like, "Oh, I got a tick bite and the tick is negative." I'm like, "Oh boy, I'm officially scared." Whereas others would be, "Oh, I got a tick. I tested it for $300 and it has Ehrlichia and 2 strains of Lyme." I'm like, "Okay, there's a chance that the tick has the germ and it never got into you." So in highly endemic regions where we are, a negative tick doesn't necessarily mean you didn't get the infection.
Interesting.
Yeah.
And does it matter if the tick was pre-fed before it fed on you? Does that matter where the germs are residing in the tick? So
yep, typically if the tick like is already fed, it's going to be laying in the grass all fat and happy. It's like not going for another meal until and typically they feed 2 or 3 times in a lifespan. So typically those are like the really hungry ticks, and typically the germs live in the midgut, although there's one study that showed that they also live in the salivary gland. So those ticks that have fed for a long time, those germs, may stay in the tick if it's a short attachment, or get transferred over to you if it's a longer attachment. The exception is the Powassan virus and alpha-gal have like a really fast transmission time, like 15 minutes.
15 minutes, right?
It's just amazing. Right. There's just so much to it.
Yeah. Ehrlichia too can be transferred quicker than the CDC's recommendation. So
right.
Yeah, my son Michael, he got bit, and within
hours,
10 hours, he had the rash on his stomach, and he couldn't get up on the bed, and but living out here and trying to keep myself educated about it, I knew exactly what to do. I feel like I took the tick, I knew the signs to look for, and I think that's important too for people to know that yes, of course, don't get bit is the one way to do it, but then what do you do when you get bit? And there are ways to do it and calmly do it and figure out Because the worst thing is if you got bitten, you didn't know you got bitten, then you're sick for later and have no idea why. At least you can, follow this tick bite and look for symptoms.
Because I'm sorry.
Really, if you're in a place where like doctors are really familiar with ticks, you could be able to bring a tick and they're like, oh, this is a deer tick, this is a dog tick, this is a Lone Star tick. And they should have an idea like of what infections you would be worried about. Like we know Lone Star ticks don't give a lot of Lyme disease. So we're not typically giving antibiotics for a Lone Star tick. But like an engorged deer tick, we definitely would give antibiotic prophylactic for something like that.
Interesting.
Yeah.
Right. Mm-hmm.
You can show signs and symptoms months after the tick bite, correct?
Oh yeah, we got slides coming on that, right? Even the CDC says babesia can take 6 or 7 weeks to show up, right? Mm-hmm. Anybody that knows me knows that famous T-shirt that I've worn that says "Bitten in October, sick in December."
Yeah.
Right. Mm-hmm. Yeah. Exactly. So great. Yeah. Let's look at our next slide there. We got more great info for people taking notes.
Awesome.
So, great. So here it is, right? This is all the different signs and symptoms from the CDC. And look what they say, from 3 to 30 days. Early Lyme disease, you could have fatigue, joint ache, swollen glands, maybe that red ringed rash that we saw previously. And it can take up to 30 days after you remove that tick, right? And, look at and this is right from the CDC. This is not Jerry or three moms blowing hot air. Look at that first point. Fever and other symptoms can occur without the rash. So the Lyme rash can be a little overrated.
Right.
Some people can get like a little small bump or redness, which is more of like a tick bite reaction. My Lugel's iodine trick tends to really work good for that. There is what's called Stary, which is tick-associated rash illness, which is like a red rash that almost looks like an EM. And typically we're treating that like Lyme just because we don't know. And naturally, as LJ already pointed out, when you get a tick bite, you could get the 4 tick germs that Mayo Clinic talks about, and you can get other germs like Ehrlichia and Babesia, which we'll see later on. Mm-hmm. But what's really interesting, if you look at that next slide from the CDC, which talks more about late symptoms, look at this, right? And this is weeks or months later. Headache, neck stiffness, arthritis with joint pain and swelling, that facial palsy, pain in the tendon, muscle, joints. And typically it's pain that moves around. Someone would say, oh, my shoulder hurts. Oh, but now my knee hurts. And oh, my ankle hurts. Now my neck hurts. And that's like this migratory, like joint pain is one of the classic types of things that we typically look for.
It's interesting. I'm sorry, but it's interesting because it's like the first symptoms, it's like, okay, you got bit, and then it's like, hey, I'm here. These are now the symptoms, just, these are pretty severe symptoms.
Yeah. I've had all of them.
Yeah.
Right.
Yeah.
It's interesting based on the type of germ that you get. Some people may just have joint pain. Some people may just have neurologic pain, or some people may have a combination between both of those. So Lyme disease can present in a lot of different ways. So especially in endemic areas, you have to have a really low index of suspicion. Even in the age of COVID, if it's August and your COVID swab is negative, but you have a headache and you feel like you have the flu, we're definitely thinking like Lyme related symptoms that way.
Yeah.
And the next slide is really interesting. Let's look at that one if we're talking about like signs and symptoms. So this is how the CDC says to diagnose Lyme disease. You have those signs and symptoms from those previous 2 slides. Mm-hmm. You have a history of possible exposure to ticks. And blood work is helpful if used correctly. But what I think is amazing, if you go to cdc.gov, It does not say that a blood test is absolutely required to diagnose Lyme. And so many times people say, oh, I have joint pain, neck pain, I have fatigue, I have headaches, but my Lyme disease test was negative. So they said I couldn't possibly have it. I'm like, well, even the CDC says that Lyme is not, you do not have to have a blood test to diagnose Lyme. They have to have
Why
those
is
signs
that?
and
Yeah.
symptoms.
Why is that? Is that because the tests are just so inaccurate, or
Yeah, there's a wide variety of testings, and new data from Virginia shows that Lyme disease may reside in the deep cartilage.
okay.
It doesn't live in the blood, it lives in the cartilage, right? So unless you're actively scraping people's cartilage to look for Lyme, the blood test may be negative.
Okay.
Plus, go back to that slide we were looking at from Stony Brook where it said Lyme can evade host immunity. And if the blood work we look at looks for an immune response, you can't mount an immune response to a germ that is evading that response.
Well,
So,
Yeah, I think people are now really know more about what a PCR testing is. And PCR testing, I feel, is very important in Lyme disease world because, correct me if I'm wrong, but really you're going to get your best results at 6 to 8 weeks. Right after that bite, that's when it's fluid in the blood and hasn't resided yet. But before that, you're not eliciting a response. And after that, it's the immune evader and you're not eliciting that response. So,
well, we always say that the PCR blood test works the best when someone has symptoms.
right.
Like if you get a tick bite and 2 days later, you're hot and sweaty and like febrile, maybe short of breath, and we think you have Babesia, you could pick up that Babesia PCR early on because you're displaying symptoms. But if someone's like, oh, I got treated, I feel pretty good, but I want a blood test just to make sure, like we would not do a PCR on someone without symptoms.
Right.
Okay. Got it.
Right. Got it. So again, what's interesting about this whole discussion is the variety of symptoms kind of comes from the interesting behavior of the germ. So if we look at the next couple of slides, which kind of talks about how these germs are actually working. Oh, and here's a good slide just on neurologic Lyme, like psychiatric manifestations of Lyme, especially in endemic areas, people with depression, anxiety, irritability. It might be worth checking Lyme there. But let's look at that next slide coming up there too. So this I think is really interesting. Like this is like what would keep you up nights. You know what I mean? The Borrelia germ has over 1,500 different gene sequences, like different color shirts that it could wear, for example. And at least 133 of these are like functional genes. The other spirochetal disease, syphilis, has only 22 functioning genes, which means that Borrelia is one of the most complicated Lyme germs that's out there, which if we look at the next slide, really is interesting. So one of the things that I always tell patients is, what do you think this means that there are so many different genetic or gene profiles with Lyme? It means that it can present in a lot of different ways. And one of the things that every medical student does is they read the Harrison's Principles of Medicine, which I actually have a nice excerpt from in the next slide there, if we check that out. And look at this, like this is the book that every medical student is supposed to read, right? This spirochete is really small, which means it can hide in deep areas of the body. But look at this quote. The most remarkable aspect of Borrelia burgdorferi is that there are sequences for more than 100 proteins, more than any other organism. So this textbook is saying that Lyme disease is really complicated.
Yep.
So
Yeah.
we know that patients can have many kinds of Lyme disease. Like Mayo Clinic says there are 4 different bacterial germs that you could actually have. So what this means is, like, I'll have somebody with Lyme disease, and like everybody else, I'll give them doxycycline. And they come back and they're like, Jerry, what are you doing to me? This doxycycline didn't work at all. I'm like, well, remember Harrison's textbook. There are many different kinds of Lyme. So for some of those patients, we'll flip them right over to amoxicillin, boom, and that works. And that starts clearing them up right away. So in people where we know they have Lyme disease, it might take several different types of treatments for it to actually work.
We're so lucky to have, I mean, where we
You.
live, we have to have, but I just always, my heart gives out to the people that either came on vacation to a place that is, tick infested and then went home and their doctors can't figure any of this out, especially like, that maybe they would just do doxy and that just wouldn't work for them. And then that person has to go on and suffer, kind of like LJ, went for years before, being able to get treatment. So I feel really lucky. I just wanted to put that in there.
Yeah, I hear you. Right.
Me too.
We're thankful for your brain.
Right. Absolutely.
Yeah.
And then the other interesting thing from the Harrison's textbook is it says that once you get the Lyme germ, it really depends on your own body for its survival. Right. And, one of the leading theories now is if you don't feed the Lyme disease germ, then that's a way of killing it. We know that Claritin or loratadine is all over the internet as being a famous Lyme disease treatment because it actually interferes with the mineral manganese, which feeds the Lyme germ. So number one, when someone comes to me with Lyme disease, I'm like, throw out that darn multivitamin. It's got manganese and you're just feeding Lyme disease, and take Claritin. That helps that.
Wow.
The other interesting thing about Lyme is, remember that it has to be able to survive in the tick and in us, the mammal, either, the human, the deer, rodents, things like that. And they use outer surface proteins, different types of proteins, in order to, make us sick. And it's called outer surface protein. And this protein actually gets into the tick's saliva and injects the germ then into our body. And that depends on this thing called SALP-15, SALP-15. And I'm always telling students of all kinds, like, if you want to win the Nobel Prize, read about and research this SALP-15 protein. If you can develop a mechanism to block this protein from working, then the Lyme will not be able to get into the body. So that's really interesting.
That's really interesting.
Yeah.
Right. So remember that Mayo Clinic defines there as being 4 major kinds of Lyme disease. And research has shown there's 100 to 133 active genotypes of Lyme disease, which makes this incredibly difficult to treat in people where you don't catch it early. And LJ kind of knows a little bit about that.
Yeah,
I do.
Yeah.
Unfortunately. Yeah.
Got it. So if we look at,
enough to go right to you when I got sick. So I was lucky enough to have that.
Yeah.
And,
I remember. Right.
Yeah. Yeah.
So if we look at that next slide, this also is really interesting, right? And again, this is not 3 moms or Jerry blowing hot air. This is all, well researched. Like, with all of this going on, climate change and Lyme disease spreading aggressively into Canada, the baby moose dying off where moose could potentially become endangered. How do we define Lyme disease? What makes Lyme disease so complicated? We could have a separate session on all of these things. But, we know that, Justin Bieber, they thought he was back into drugs, but, it ended up being Lyme disease. One of my favorite stories is Chris Christopherson, who was basically put in a nursing home because he couldn't operate a fork and didn't realize that he needed to go to the bathroom and forgot relatives' names, and they thought he had Alzheimer's. And finally, the wife chimed in, will someone give my husband, Chris Christopherson, $30 worth of doxycycline? And it changed his life, and he's like back on tour.
That's
And
yeah.
yeah, amazing. And look at this next slide. Most of you have heard about Ali Hilfiger and Yolanda Hadid from the Housewives. So these are important because all of these people now realize what a big deal prevention is. But it also reminds, if you're like lost and alone and not feeling good and dealing with Lyme, we know that you're not alone, right? That people are actually putting it out there.
Yeah.
Now look at this next slide. This is actually really interesting. This is Stanford University. Hey, they're pretty smart there. And they actually published that in 10 to 20% of people, the Lyme disease germ can actually persist over time, right? So, very often people will say, oh, you take Lyme disease medicine for 3 weeks and everybody is back to normal. I'm like, well, maybe you better check with Stanford University. And then some people are like, Jerry, 10% of people, that's not much. But if you think on a typical Long Island weekend, if 200 people are getting Lyme disease, that's, 20 to 40 people now with persistent problems. 40 people every weekend, that number builds up really pretty fast.
That's a great way of putting that.
Yeah. So the idea of persistent Lyme, is a big deal. So I definitely agree with Stanford. Yeah, 90% of people get over it. But who's making noise for the Yolanda Hadids and Justin Biebers and the mailman who's not getting over it? You know what I mean?
or isn't diagnosed at all because they don't know that that's what it is.
Right.
Yes, exactly. Which is why on Long Island, there's a huge Latino immigrant population that has no idea about any of this.
Yep.
So, we have, with the Southampton Tick Center, tried to make more preventative stuff in Spanish, trying to get outreach going there. You know what I mean?
Yeah. Yeah.
Great. Right. So if we look at that next slide, I thought that this was also interesting, right? As we said, from the Harrison's principle of medicine, the Lyme germ depends on the patient to thrive. And we know that manganese is one of the things that the Lyme germ really needs. So again, I'm telling people, don't take manganese, right? Look at this next slide here. This one's pretty interesting also. And this was a really great study which showed that, look at the bottom there, Borrelia treated with desloratadine, right, the whole antihistamine group, exhibited a loss of intracellular manganese, and that helped to kill the germ. And let's look at the next slide.
Interesting. Yeah.
Yeah. Mm-hmm. And here was a great study on what we call the transition metals, right? Iron, copper, zinc, and manganese, right? So a lot of physicians are like, Jerry, my patient needs iron and copper and zinc, to function. I'm like, well, yeah, at least have to stop it for a few weeks to kind of help move the Lyme along.
Right.
Why would you buy $500 of Lyme vitamins or buy $200 of prescription medicine, and then you're taking a vitamin on the one hand and feeding the germ while you're also trying to kill it? It doesn't make any sense. Right?
It's like a blocker. Yeah.
It's
right.
really interesting.
And then look at this next slide, is pretty interesting. Also, this is actually, and you can Google this, metal dependent gene regulation. And they were able to document out how these different metal dependent genes help to feed the Lyme germ. But not all hope is lost. If we look at this next slide, which gives us kind of a little bit better idea of what to do about it, they've actually done studies that show that certain essential oils, like oregano, cinnamon, clove, have been shown to work against some of this persistent Lyme even better than antibiotics like daptomycin.
Interesting.
Yeah.
And LJ, it's funny when like a doctor, PA calls me, they're like, Jerry, what are you doing giving this patient like oregano oil? They're like, are you nuts? I'm like, actually, I'm following this study from Johns Hopkins.
Yeah.
If you don't like it, maybe you better take it up with them. You know what I mean?
It works.
And then look at this next slide is also interesting. And again, you can look up this in more detail online, right? And this is kind of some of that same information about cinnamon working against replicating Borrelia, even garlic. So there's a lot of good data on non-antibiotic therapy for Lyme, even though I suggest everybody start with like antibiotic beforehand. And let's look at this next slide.
Is that something you can do together? You can take the oregano with the antibiotic, like you can.
Oh yeah, absolutely. So you have to space them out. You don't want them all mixing in the stomach at the same time.
Okay.
So, right. And again, everybody probably here uses stevia in their coffee, but there's a particular stevia extract which has also been shown to be really potent against Lyme disease. So remember the story of the person that took Doxy and didn't feel better? And then I gave them amoxicillin and they did feel better based on Harrison's textbook. If they come back still not feeling better, that's when I may be doing the Claritin, some of these essential oils. And look at this article about stevia, right? And it shows that a certain stevia extract actually works on, look at that term at the top, various morphologic forms of Borrelia. So of all the different strains of Borrelia burgdorferi. So again, the point of this data is, number one, that there are lots of ways to treat Lyme, and B, there are actually big universities that are studying this problem of what to do about Lyme disease. And that's about as exciting as it gets, I got to tell you.
Well, the information is changing rapidly. All this information coming in, all these studies, there's a lot of these studies, and these studies are becoming peer reviewed at this point. And now that information can get out there and get to doctors that really don't understand Lyme as well as you.
Yes. And LJ, that's what I say. I'm like, hey, this is Stanford. This is Johns Hopkins, Columbia. These are big names doing big stuff with Lyme. So.
Didn't Columbia and Dr. Fallon just put out a study about mental health issues relating to Lyme disease? And very large numbers of mental health patients were actually Lyme disease patients. Didn't it just come out like last week?
And it showed the overlap of where the ticks are, and then you pull up the overlap and it like shows
of where the psychiatric disease is, right? Absolutely.
And also they were saying about drug use too, because they were trying
to
self-medicate because they couldn't find answers.
Yeah, exactly. They're all on CBD or doing over-the-counter SAMI and those kind of things.
Right.
So,
Very interesting. Awesome.
Right.
Yeah.
All right.
Yeah. So look at this next interesting slide here, right? So it just even gets more, when you thought it couldn't get more interesting, right? It even gets more interesting. So this was a really big study, including Yale, even over in the UK, Germany, where they actually found that in patients with Lyme arthritis, joint pain, swollen joints, things like that, that a peptidoglycan actually persisted in people with Lyme disease. So let's look at the next slide here. And so this is actually showing now that in patients with persistent disease, they're actually identifying the germ in cartilage, in soft tissue, right? And look at that fourth line down. Although antibiotics are effective at all stages, arthritis may persist for months or years despite IV and oral antibiotic.
Wow.
2 knee replacements.
Dysregulated host responses are thought to play a role in this, and they're still trying to figure it out. And it might be that this peptidoglycan theory is going to be the new gateway as to why Lyme disease persists in the body.
Yeah. I've had both wrists operated on and 13 knee surgeries, ending up with 2 knee replacements that it just continued to deteriorate no matter what we did.
Yeah.
Right.
So, yeah.
Right. And that's probably this whole peptidoglycan theory.
Oh,
Right.
So,
and 5 herniated discs.
ouch.
So
Yeah.
But
it's all,
now we know we can save some of that tissue and actually do a PCR on the tissue to see if Lyme is actually there. So like when people have like knee and meniscal surgery, you know, I'm like, see if you can get a little bit of that tissue for us to test.
okay.
So, interesting. Well, hopefully you
I don't
to
have
do it
any. I
again.
don't
I'm
have
like,
any left.
no.
Any left?
Yeah.
I hear you. Exactly.
Yeah.
So,
Yeah.
so all of you in the 3 moms world out there listening to this, remember that this stuff is preventable. You know that it's very complicated. We can't agree on what the definition is. We also know that even though some people don't like the CDC, their mechanism for diagnosing Lyme, their signs and symptom list are amazing, right? We also know that, you know, there's a bigger word on Lyme, whether it's climate change or movie stars sharing their story. We also know that there are new, exciting, and innovative types of treatments, both prescription and non-prescription treatment. But again and again and again, as they keep saying on the website, prevention, prevention, prevention. If you don't get the tick on you, or if you get it off as soon as you can, that's what's best for you.
Very interesting. Thank you so much for that.
Yeah.
Yeah.
Jerry, is it possible to have you on again and we can talk about alpha-gal, and we could talk about more prevention, we could talk about maybe mental health and Lyme disease? I feel that that's a really important
Yeah, that's a big one.
yeah.
I agree.
And it's really, I'm so glad that these studies are finally coming to light, because
Right.
when I was sick, I started to have mental health issues, which was unusual in a woman in her 40s to start having them.
Suddenly,
Yeah.
right.
Suddenly, like
Yeah.
out of nowhere. And for me, it really would mean a lot if we really covered those.
Absolutely.
All
So
right.
Yeah.
great
All right.
stuff.
We're so gracious that you gave us your time today. Really,
Appreciate
it's
it.
like,
Thank you.
Anytime. Good stuff.